All right, Michael, I have the top of the hour. I think we should go ahead and get started to be respectful of folks' times. Hannah, I just want to make sure we're recording this for those who can't join live.
Yes, confirmed.
All right.
Thank you so much, Doug. Hello, everyone, and welcome to today's ASBMR-BHOF Virtual Hill Day training. My name is Michael Hadjiargiru, and I am the chair of the ASBMR Advocacy and Science Policy Committee. On behalf of my committee and the entire ASBMR leadership, I want to thank you for taking time out of your busy schedule to join us today. I also want to thank you for agreeing to volunteer your time to serve as an advocate next week. We are excited to be able to open up this important and fun volunteer opportunity to the membership as a virtual event. So before we start, let me introduce our panelists today. I would like to introduce Claire Gill. She's our Bone and Health and Osteoporosis Foundation Chief Executive Officer, Doug Fessler, ASBMR Executive Director, and Hannah Miller, ASBMR Senior Operations Coordinator. Let's review the agenda before we start. So this is the agenda for today. We just did the welcome. The Medicare reimbursement for FLS is the first topic of the day, meeting tips, online schedule and logistics, leave behind materials and participant documents, questions and answers. So Claire Gill will be providing us with background on Medicare reimbursement for Fracture Liaison Services and present the Hill Day Ask. Doug will be providing us with tips for meeting etiquette and logistics and the online platform and review of leave behind materials and participant documents. And Hannah will be providing us with social media tips and contact information for Day of Questions. During today's orientation, all participants will be in listen-only mode. If you have any questions during the presentation, please use the Q&A feature at the bottom to submit your question. All questions will be answered after the presentation. Also, today's presentation will be available as a recording on the ASBMR website. The slide deck will also be available on the website to download. So let me hand it off to Claire.
Thanks so much. Thank you all for being here. We really appreciate your participation. The Bone Health and Osteoporosis Foundation is delighted to be partnering with ASBMR in this important Hill Day. So I'm going to cover some of the basics about what we will be doing during the Hill Day and what we will be asking you to help us with. So the focus of our Hill Day this year is Medicare reimbursement and the Fracture Liaison Service. Medicare, for those of you who may not be as familiar, is a federal insurance plan for people over the age of 65, administered by the Centers for Medicare and Medicaid, which we will be referring to as CMS during this trade. Within CMS, they have supervision for a number of different policies and processes, and one of those is called the Physician Fee Schedule. It is a complete listing of the fees that Medicare will pay doctors or other clinicians to administer the care needed for patients throughout their practice. The Physician Fee Schedule is updated annually, and so we will be talking with them about the next Physician Fee Schedule, which will be in fiscal year FY24, and it's currently under development. So now is the perfect time for us to be visiting them and asking them to include the osteoporosis care, the post-fracture FLS in that reimbursement model. Medicare doesn't currently pay for clinicians to do any post-fracture follow-up care that ensures that people over the age of 65 who've had a fracture have the follow-up care they need to address the underlying cause of that fracture, which is most likely osteoporosis. The Fracture Liaison Service is a model of care that has been proven domestically and internationally and tested numbers of times to ensure that people get the post-fracture care that they need and that they will be able to get the support they need to prevent future fractures. ASBMR and BHOF are pursuing Medicare reimbursement for this FLS through the CMS Physician Fee Schedule. And that's what we'll be asking you to discuss with your members of Congress. There is no congressional legislation required to change anything in the Physician Fee Schedule. So you're not asking them to do anything that's really very difficult. It's really just prioritizing what we were hoping they would focus on in the Physician Fee Schedule. In the FY23 physician fee schedule, they did acknowledge that osteoporosis is a public health crisis, and they made some comments regarding modifying some quality measures, but none of that is what we really need to make an impact on improving post-fracture care for osteoporosis patients. We need them to include an FLS reimbursement model. Our sense is that we just didn't have FLS as a political priority, and that's why it wasn't included in the physician fee schedule last year. So this year, with your help, we will be focusing on it and hoping that the members of Congress you're speaking with will contact CMS to make it a priority for the FY24 fee schedule. We're applying what we call political pressure, and this is a good thing. CMS hearing from members of Congress saying, please make FLS a priority in your FY24 proposed rule. So here's how the meetings happen. It's really pretty simple, and Doug will get into more of the specifics about preparing for the meeting and what's happening on your screen during the meeting, but generally, you'll make a brief introduction, and please do keep it brief. You just want to tell them, who you are and what part of their district or state you're from. Then you'll make the ask, which we'll cover in the next couple of slides. It's really important that we make it clear to them why you're having this meeting with them. We'll talk about a little bit about why it's important to you. Why are you participating in this Hill Day? And that's what really matters to your member of Congress. They want to hear from their constituents about why these issues are important. We'll summarize why change is needed. Why do we need to make this change to the physician fee schedule? And then we'll end the meetings by reiterating or restating the ask. I know it gets a little redundant, but trust me, this is the way it goes to make sure that the person that you're meeting with is fully aware of what you're asking them to do. So here's the ask. We basically start with, I am here to ask you to please contact CMS Administrator, Ms. Chiquita Brooks LeSueur, and urge her to use CMS's authority to update Medicare payment policies so that people who suffer osteoporotic fractures get the cost-effective care they need to prevent additional fractures. This will save lives and reduce Medicare costs. Now, you can read this just as I did during the meeting, or you can kind of make it your own as long as you make this ask. And the ask again is to urge them to contact CMS and make osteoporotic fracture reimbursement a priority. Then you'll talk a little bit about why it's important to you. And I know we'll have a lot of different constituents participating in this Hill Day. But if you're a patient, then you want to deliver information about why this matters to you. Was it your mom? Was it you? Was it some other member of your family that has been impacted by osteoporosis? Why is it important? And it's the same if you're a clinician or an investigator. Why is this so important to you? We want to, again, share why there's a need to spend more time and effort in preventing preventing future fractures, and why post-fracture care is so important. If you don't really know what to say, if I was like sharing this story or just would like some other additional information, we have these facts prepared. You will receive these ahead of time and they'll be available to you during your Hill Day virtual visit. So please don't worry about memorizing these. And you can choose the one that you think has the most relevance to why you're participating in the Hill Day. But these are all great pieces of information to deliver to the person you're meeting with, so they understand that, again, you're here for personal reasons or professional reasons, but you also have a greater cause that you're speaking to. And these facts kind of cover why osteoporotic fractures have such a detrimental impact on our healthcare system and on our population. And then why change is needed. So again, this is kind of explaining to the members of Congress or the people, the staffers that you're meeting with, why we are asking them to make the change in the physician fee schedule. Right now, as we said, there is no process in place to be able to be reimbursed after a person breaks a bone and a clinician is trying to do all of the follow-up necessary to make sure that the person gets tested and, if needed, treated for their osteoporosis. You'll find these information available to you as well prior to the start of the Hill Day, and you can refer to it as often as you need it. And then again, at the end of the meeting, you want to thank them for taking the time to meet with you and ask again. I'm here to please ask you to call or contact the administrator of CMS and ask her to use CMS's authority to prioritize osteoporotic fractures and the post-fracture care that's needed in the new physician fee schedule. We're here to save lives and reduce Medicare costs. Now I'll turn it over to Doug, and he's going to go through the tips and reminders for you.
Thanks, Claire. And I just want to echo all the presenters before me in thanking all of you all on participating on this Hill Day. This is extremely important. And this year, I know it's a little different. It's a little different ask than we have in the past, but it's if not, it's just as important, if not more important and timely. So some meeting tips. Please log on promptly to your virtual meeting. So, that means, logging in about 10 minutes early, turn off your cell phone. Expect that the meeting's going to last 15 to 20 minutes for each meeting. As Claire mentioned, introduce all participants, name and affiliation. Let's get through it quickly because you really want to get to the ask. Sharing a personal story, again, is important, but if you're not comfortable, or if you don't feel like you have a good one, lean on those facts that will be handy for you during the meeting. If you don't know an answer to a question, that's okay. Just make sure, just be upfront. Say you don't know, and you'll get back to them with the answer, and then send a note through the system to ASBMR-BHOF staff, and we can follow up on your behalf. Present leave behind materials. You don't have to worry about this. We will be sending the leave behind material to all the members that you're meeting with prior to your meeting. And again, if they say they didn't get it, just let us know and we'll send it to them again after your meeting. Some follow-up items for your meetings. Send thank you notes. Again, this is something that we made easy to do via the meeting platform. So after your meeting, stay in the platform and just quickly send that email or that message through the platform. There's a pre-populated message that goes out. You can send that, or you can modify it as you see fit. Be sure to add your contact information so that the member of Congress or their aide has that information if they want to get a hold of you. If there is any follow-up information that you promised them, just remember that links to online documents are better than large PDFs or files. The email systems on the Hill don't really allow for really big attachments. If there are any items that the member of Congress or the staffer promised you, make sure you follow up with those as well, and you keep ASBMR and BHO staff in the loop regarding that. And again, if there's any questions or concerns that you have, please reach out to us. We're here to support you, and if it means us reaching out to the congressperson or the staffer on your behalf, we're happy to do that. Some troubleshooting items. I think everyone's going to have a smooth meeting, because the reality is that these folks are meeting with you, and all day people are coming into their offices or onto their Zoom screens saying, asking for stuff. So don't be, they'll know what you're talking about. But if you do get a blank stare and no response, pivot back to the ask and what you want them to do. And if they have any questions, making yourself available in terms of contact information. If they seem distracted in this day and age, I just know we're all doing 18 things at once. It happens. Again, be respectful, be patient, and just pivot back to that ask. If the person you're meeting with doesn't appear to know anything about CMS, again, what you can say is, it sounds like you have a lot of questions, and I know we have limited time. What I'm going to do is I'm going to get someone from ASBMR or BHOF to reach out to you and provide additional information or set up a meeting, and then let us know about that. And finally, if the aide makes a political or partisan comment or asks your opinion on political matters not related to our ask, pivot. Don't answer it. The best way that I've learned is just say, I don't know about whatever the topic is. All I know is I'm here today to ask you to contact CMS administrator, because this is a really important issue to our state and to our constituents. So a lot of you have done these before. If you haven't, it's never too late to start a long-term relationship with your member of Congress. There's keys to this: identifying connections with your elected officials. Maybe you all went to the same college. Maybe you went to the same church. Maybe you have a favorite lunch spot that you both like. Know that and take note of it so you can refer back to it later in time. Certainly being a better constituent, subscribing to their electronic newsletters, following them on social media, attending town hall meetings and local events, staying in touch throughout the year, letting them know about the topics or research that we're discussing you're discussing during your meeting, or just making them abreast of federal funding that you receive through NIH or other funding mechanism, or just any other great things happening at your institutions or in your districts. And finally, document the visit within the department and institution newsletter. Hannah's going to talk about social media. We'd love people to take pictures and share those because we want to share them, and certainly sharing those tagging your elected officials helps too. So lets them know that it means a lot to you. I want to touch a little bit about the online schedule and logistics overview. This is very high level. We're going to be sending a longer form video from Advocacy Associates if you feel like you want to take a little longer training on the system. Again, for anyone who's participated in our virtual meetings over the last couple of years, we're using the same platform, and it's really easy. But it starts with an email that you will receive from Advocacy Associates on Friday, Friday afternoon. So be on the lookout to that. If you don't receive it, please check your spam folder. It looks like this. It's going to have the information for you to log into the system. I can tell you if for past participants, you already set up an email and log in. So if you don't remember that password, just click the forgot password and it should send it to the email that you received the original message from, so you can reset your password. And if you have any questions or concerns, the email also has a link to Advocacy Associates where you can reach out to them and they can get back to you promptly. When you do log in, what you'll see the list of your scheduled meetings, as well as the list of meetings that we're currently confirming. As part of that, as well as you can see the time for those meetings. Those times will be displayed in wherever you're located. So it will be whatever local time you're located in is the meeting times being displayed. To get access to your meeting, please just click on the individual meeting and it will take you to this page, which is basically the meeting page. It has the date and time of your meeting. It tells you who you're meeting with, as well as the staff people. Click join online meeting to join the meeting. If you can't make it via video but need to participate by phone, it has the phone and details. This platform that we utilize is basically a bolt-on of Zoom. So if you use Zoom like we're doing now, then you should have no problem utilizing the video content. Some other things, Claire mentioned the talking point. The asks will be for our system. It will be up here at the top so that you could minimize the screen while you're meeting with your member of Congress, and you can easily read it. So know that that's going to be there. The same thing with under documents and resources. We're going to have the facts sheets as well as the why this is important. Again, you can click on those and those little bulleted points, you'll be able to see those as well. So we try to make it as easy and comfortable as possible for you to do these asks and have these conversations. All the attendees, we are scheduling meetings. Your meetings will include other individuals from your states or nearby states. All those individuals who are in attendance or planning to attend or confirmed to attend will also be listed here. And finally, I just want to note that the send thank you note, once you're off your meeting, you just click that button, the note will pop up, and you can quickly send that message to your representative or your senator as well as their staff people. If you have any questions or having any problems, the support button is up here. As well as any kind of meeting report form in terms of follow-up that you need for ASBMR-BHOF staff to do on your behalf after the meeting. Kind of just a summary of these things that I just kind of mentioned. Check your spam and junk folder for that email this Friday. Please plan to call to dial in or connect to Zoom about 10 minutes prior to your start time to make sure that you're on time. Also note that, you know, if the member of Congress or their staff might be a couple of minutes late, if you don't hear something back, if you don't see them show up 10 minutes after the start of your meeting, hit that support button and advocacy associates will reach out to them to see if what's going on. But be patient, it just happens. There's a lot of back-to-back meetings on the Hill. As I mentioned, all the time zones shown are located when where you're viewing your schedule. You're going to receive an email 1 hour prior to each of your meeting that it's happening. The help numbers again are in the support tab. Meetings are going to last about 15-20 minutes is what is typical right now. And any changes to the schedule day of are going to be sent to you via email. So know that, so please be on the lookout on your emails because it won't be reflected in the system. It will be an email sent out. Some just logistical things, make sure you have a good Wi-Fi signal for your meeting, mute your microphone if you're not speaking, and know your audience, ensure that you have appropriate background on your Zoom if you're on video. Again, here is the ask. Again, that will be in the system as well. So you could again read it verbatim or summarize whatever you're comfortable with. As I mentioned, leave behind materials. These are going to be sent out prior to your meeting, but what they include is a 2-page summary of the problems and solution. The sample Hill letter to CMS, basically that is the letter that we are providing that what we want them to do. We're asking them to reach out to CMS and say, hey, listen, I included a sample letter as part of the leave behind material. So you can look at that, you could copy that and paste that verbatim and send it to CMS, or you can certainly, they can revise it as their own, but we made that. And then Medicare costs for osteoporotic fractures by state. BHOF commissioned Milliman a couple of years ago to do this fantastic review of the Medicare data. And what we're going to also be providing is your state-specific Medicare costs of osteoporosis fracture data in those leave behind materials. Again, those participant documents has a little blurbs about ASBMR and BHOF, as well as fact sheet and the why change is needed. And I'm going to leave this to Hannah to talk us through about the social media.
Thank you, Doug. As Doug has mentioned previously, social media is really powerful during the Virtual Hill days. This is our hashtag ASBMR-BHOF Hill Day that you can use on your social media accounts. Also, be sure to include ASBMR at ASBMR on Twitter and at BHOF, along with the congressional member or senator that you met. If you tweet at him or thank them, that will go a long way. So it's really important that you get the message out on social media. Next slide. In addition, there's a lot of support through advocacy associates, but I am your main contact person for the Hill Day for any questions. So you can contact me directly with my email address. I'm sure many of you have already contacted me before, but hmiller@asbmr.org, and you can call me directly at 202-367-2343. We will be sending emails the day of and leading up to the Hill Day, and I will have this contact information in all those emails. So you'll be able to contact me if anything happens. Thank you.
Great. All right, thank you. I think we have time for Q&A. We whizzed through that, it seems like, huh? Any questions, Hannah, through the system?
I don't see any at the moment.
All right, well, good one.
We've got a great group who knows exactly what they're doing.
Well, if there are any questions, email Hannah. She has the answers to everything. All right. Did we cover everything, Claire, Michael, Hannah? Is there anything you can think of? Any other helpful hints? There's a question. Have you reached out to specific members to see if they can get states covered? We haven't. You know, the Hill Day is it's a good question. The Hill Day is one aspect of what we're doing this year, but I also recognize that it's hard. People are busy, and there's a lot of scheduling difficulty in scheduling. But you know, this is the one thing. We're also doing legislative alerts. We're reaching out individually for member ASBMR and BHOF members to contact members of Congress. So there's a full court blitz going on this month, mostly this month, because we know that the CMS has their pencils in hand and are starting to put together the physician fee schedule. So we're touching a lot of members directly by email to make kind of simple asks. I can tell you that to date I've been very moved and impressed by how many members have been willing to you know, reach out as constituents to do these things.
We have another question. Chat.
Oh, yeah, it's more of a comment, but I agree.
Oh, yeah, it's a cool comment. Yeah.
Listen, this is we got to get this thing across the finish line this year. I know Claire and I have been talking about this a lot. This is the big push year to get this through. And we feel, you know, there's no guarantees, but man, I feel really good. And I have to say, again, I'm just impressed with the ASBMR membership. I'm really just excited that we're working with BHOF. I mean, this is you know, the relationship with BHOF over the last 2 or 3 years, really around this, it's been really great. It's just great to have a partner in crime, so to speak, to kind of get this across the finish line. All right. Well, I don't see any questions. I'm going to give everyone a last chance, but if you do, let us know. Shoot Hannah an email, or myself, or Claire, or Michael, and we'll get back to you. But thank you again for participating next week. Thank you for responding to mine and Hannah's emails over the next couple of weeks, because we're going to, don't think that this is one and done if you're just participating in Hill Day. But we're going to get this, you know, we're going to get this thing done this year. That's everyone's hope.
Thanks, everybody. Thanks, Doug. Thanks, Hannah.
Thank you all. Bye.
Bye-bye.